What has COVID-19 taught us about Canada's healthcare system?
I think it's taught us that the healthcare system needs a significant revamp because a lot of the structural and infrastructure problems that we deal with has been brought to light. You know, when it comes to shortages of nurses, shortages of doctors, long wait lists in order to get a doctor, all those things came to light, and the suffering that people had to deal with because of that is now a bit more prevalent and a bit more obvious than it was in the past.
That we do not have enough doctors and nurses in Canada, that we need more beds, and that our system is very lacking in emergency measures. And when a big thing happens like this, there's nothing to help with regular hospital needs because of those shortages.
I have a confidence in our healthcare that we can, as a people, appreciate the healthcare workers, and I think we did an okay job. Can always do better, but I think as a people we also look to the positive.
I feel like it's taught us that there's a lot of gaps in our healthcare system and vulnerabilities. We need more nurses. We need nurses to be taken better care of. We need to improve our education for people going into healthcare, all the way from home care all the way to doctors and nurse practitioners. There needs to be more support, more education, and more money to help train those people that are going to take care of our health system for the future. So yeah, I think COVID-19 has identified some weaknesses and vulnerabilities in our healthcare system that we now need to really start working to fix.
Well, I think COVID-19 has taught us that we don't know as much about our healthcare system as we would have liked beforehand. So we've learned a bunch. We've learned we need to be react more quickly. We need to be definitive in our statements around healthcare. We need to really take a look at the quality and capability and capacity of our healthcare system and how we can bolster it to meet the needs of Canadians.
It's pretty disorganized, lots of resources lacking. And a lot of the money that was spent didn't lead to more resources being available. And we're seeing that right now as things open back up.
And then people were burnt out in the healthcare system. And I believe that's why a lot of people quit, and that's why we're shortage of healthcare workers.
I really do not believe that we were prepared. I think the Canadian system could be a whole lot better in coping with having enough staff, enough technology to deal with what we were faced with the pandemic.
I think that we're realizing that we're able to maybe have access to medical services or a doctor's service without a personal visit to the person or the doctor or the service. We can have it by Zoom or video conference, and it's more accessible that way and maybe less waiting time.
Straight answer, it's a lot better than the miseries say it is. We coped very well. We took care of an enormous number of people. If we could miss a few, we missed a few, but only a few. I think it was terrific.
I would say one thing it taught us was that there was not enough capacity in the ICUs, as well as probably in the hospitals in general, because they got overwhelmed pretty quickly.
I don't know if you're familiar, but out here in BC we have a doctor problem right now, a shortage of doctors and a shortage of people staying in the general practitioner field, and the tug to get into some private health care. And when we do look around the world, in my view, we see better healthcare systems that blend the two together better.
I think they've done really good with what they knew. None of us knew about this virus. And yeah, I think we did the best we could, and I think we're coming out of it now, and hopefully it'll bring everybody a lot closer.
We've always trusted our government and our people behind us and above us to look after us, and they didn't look after us. Not because they didn't want to, but because they didn't know how to.
Well, we had COVID early on, and we were totally impressed with the system, how it worked. We had a call from a nurse or a doctor every day for about 10 days. We were completely informed on every aspect. Once the vaccinations came in, we got email notices of when to come in, and booking was very easy. We were able to get vaccinated quite easily, and I'm totally impressed by their response to the whole COVID thing.
We need to provide a lot more opportunities for education and a lot more opportunities for individuals to be involved in their health care, especially First Nations and whatnot. Like, there needs to be a lot more emphasis on patient-centered care, I would say.
I have a lot of faith in them, and the Chief Medical Health Officer, especially for the Northwest Territories, a lot of faith in her. I believe in the science of the whole thing, and I think we've sort of caught up quick enough. We had some issues, and things like long-term care facilities, they pointed out other issues, not necessarily COVID related, but just like understaffing, lack of training in staff, and those institutes that are like pay per use kind of thing are really like the bane of the Canadian healthcare system. So,
but it has taught us that we need to be very prudent about the viruses that are going around. Definitely, it can slow down the system to a halt.